Hello everybody, I'm Dr. Sachin Kulkarni and I'm going to discuss with you what sperm parameters will play a role in achieving a pregnancy for you. I'm going to highlight specifically on two things. Number one is the Teratoozoospermia, where you see a lot of abnormal sperms. And number two is the sperm DNA fragmentation. Let's talk of seeing a lot of abnormal sperm, which is reported as Teratoozoospermia. Your semen report can say, well, you have only 2% normal sperm. But believe me, by Kruger criteria, even if there are 4% of the sperms are normal, that is a normal semen analysis. And this is by WHO 2021 guideline. So don't worry about Teratoozoospermia. Since the sperms are produced in millions, few of the sperms are going to have abnormal shapes and sizes. That doesn't mean they are very, very bad sperms. And moreover, in a natural pregnancy, when they did a study with teratoozoospermic samples and semen with normal semen, the pregnancy rates were the same. When it comes to IUI, when you do sperm processing method, the teratoozoospermics do not get selected and IUI pregnancy rates remain the same in spite of couples having teratoozoospermia. And when it comes to IVF or ICSI, especially ICSI, it is an operated selected sperm. The embryologist himself will look under the microscope at 1000x magnification and select morphologically normal looking sperm. So all the teratoozoospermic samples, the teratoozoospermic sperm, an abnormal looking sperm like a bifid tail, a big head or a pin head or a double head, etc., will not be selected when it comes to ICSI. So let's be assured that teratoozoospermia will affect your fertility prognosis and your chances of getting a pregnancy. The second factor is sperm DNA fragmentation. The sperm DNA fragmentation is actually tested by tunnel or comet assays, but they are not commonly available to all of us. So most commonly tests which are done are sperm chromatic dispersion method or SCD method. This test has a very low potency of detecting actual sperm DNA fragmentation. But if you do sperm chromatin dispersion method of DNA fragmentation 2 times, and if both the times it comes positive, then it is significant. In women or in men with sperm DNA fragmentation high can be treated with antioxidants. But you know something? Sperm DNA fragmentation low or high basically does not make much difference when it comes to pregnancy rate. It is the age of the lady that guy is married to. So if you have a husband with a high sperm DNA fragmentation, but his wife is beyond 36 years, has a low ovarian reserve or has obesity, well, her oocyte is also having some defects and then chances of fertilization are poor. But a guy is there with a high sperm DNA fragmentation, but the wife is young, thin and has a very good ovarian reserve, that sperm DNA fragmentation wouldn't make a difference. The sperm itself, that DNA fragmentation, will get corrected the moment it enters the oocyte, because the oocyte has enough amount of cytoplasm, mitochondria and enough sperm repair abilities. So oocyte typically acts like a female, making neat and clean the sperm and have a successful fertilization. So many male factors are actually not revealed, I feel. If males are married to perfect women with a young age, thin body and having a good ovarian reserve and a healthy diet habit, even with poor sperm parameters, getting natural pregnancy is pretty simple. I hope that makes a difference to you. For any further queries and your second opinions, you're most welcome to consult us. Thank you so much.